to the fourth video in our Keystone Principles of Mental Health series. In this video, we'll be teaching carers how to process emotions to prevent a breakdown or the development of anxiety, depression, or other stress symptoms. You will recall that self-preservation has the symbol of the lifebuoy and was metaphorically illustrated by a mother on the plane putting the oxygen mask on herself before her baby. The second principle was boundaries, which had the icon of the barbed wire fence. It focused on self-protection and on separating your obligations and responsibilities from those of others. The third principle, self-worth, was represented by gold bars, indicating both value and rarity. The take-home message here was that gold is invested and that healthy relationships are characterized by equal and reciprocal emotional investment. You also learned how to differentiate between an investment and a donation. Investments are made with the expectation of a return. On the other hand, in the case of donations, you do not expect to receive a return. Now, you are ready to learn the crucial importance of processing emotions. Processing emotion is about breaking our feelings down into manageable, digestible parts. Much like a food processor breaks down lumpy food that would otherwise be difficult to digest and which, when left unprocessed, might even cause indigestion and discomfort. This is why we have chosen a food processor as the icon for processing emotions. In order to preserve and to protect your mental health, each of the Keystone Principles must be understood, internalized, and implemented. Dealing with emotions is no different. Trauma and emotional upset left unprocessed will often fester, much like an abscess will form if the infection is not addressed. If you leave emotional issues unprocessed and unaddressed, you cannot practice your other Keystone Principles, especially self-preservation. Being stoic and strong when confronted with a crisis, trauma or loss is generally regarded by the community as an asset, a sign of resilience and a sign of having a strong character. People in professions like the military and police set that standard. In fact, they and other first responders are self-selected because it is considered part of their job. It is accepted and expected that they are psychologically robust during their training, and while doing their job, they double down emotionally and are valued, praised, and even promoted because of their ability to be cool-headed and make rational decisions when they are metaphorically under fire. In other words, during challenging times of confusion, chaos, and stress. Unfortunately, the consequences of this societal pressure and expectation are all too often tragic. Witness the high numbers of veteran suicides and the ballooning numbers of first responders who have to be medically retired because of PTSD or burnout. Carers like you may aspire to be similarly durable and tough. You often soldier on, ignoring how you feel. You push through even when floundering emotionally, because you believe it is part of your job and what is expected of you. However, this is a clear case of our strengths eventually making us vulnerable. These perceived strengths can become our greatest weaknesses. Lacking this understanding, and without adequate processing, even the most robust individuals will eventually break themselves emotionally. Pushing yourself past your limits to the point of no return is much the same as ignoring the flashing red light on the dash of your car that tells you you are overheating. All too often, we only stop when our metaphorical motor blows up. In other words, too late. People frequently fall into the role of becoming a carer due to a conspiracy of circumstances. For example, you may become responsible for an aging parent, or find yourself having to manage caring for a child with a disability. Our circumstances frequently influence our behaviour and the decisions we make. However, some consciously choose to become a professional carer, whether in a nursing home or, where needed, in other essential roles in our community. These individuals may be slightly better suited to the job's rigours and may well be trained to meet the emotional demands of their work. However, notwithstanding this, in my 30 years of experience, because of the demands of their vocation, I believe carers face a significantly higher risk from the point of view of their mental health and psychological well-being. The demands are great. The finish line is shifting and ambiguous. Yours is an essential but sometimes seemingly thankless task that can leave you emotionally depleted and exhausted. This brings us back to the fourth keystone principle of mental health: processing emotion. Over the next few minutes, I will teach you simple, practical approaches and strategies for coming to terms with emotional upset and loss. Metaphorical therapy helps by breaking the process down to 5 easy to understand steps, which I liken to steps on the controls of a food processor, in which big chunks of upset are broken down into smaller and smaller, more manageable pieces that are easier to cope with. Step 1. Identifying when you're upset sounds pretty simple, but many a hardened soldier or copper might only recognise they're upset after they have kicked the cat, or the next morning when they've woken up with a headache, having failed to drown their sorrows. Being aware of how you are feeling, for example noticing when you're upset, and signs like developing a shorter fuse or becoming intolerant and more easily irritated, is a fundamental first step. The next step is to label your upset. I feel upset, angry and sad. Acknowledging and describing how you feel takes some of the heat off the suppression and avoidance pressure cooker. Expressing your upset and letting it out is the next step. As is often said, you feel lighter when you've got an upset off your chest. Or you have to feel it to heal it, as I like to say. An old saying, a problem shared is a problem halved, encapsulates the next and final step. This is where you express your upset to someone who can catch and acknowledge the legitimacy of your upset. It is not just having a support network that's important, but it's asking for help or time from that caring friend or family member that's important. Carers need to appreciate that their job is difficult, not just because it's physically demanding, because it's psychologically exhausting. Like death from 1,000 cuts, an emotional deterioration when caring for someone usually happens so slowly as to be imperceptible. As a carer, it is critical that you understand this and get it at a deep, intuitive level. This is the only sensible way you can take the steps to avoid burnout or a breakdown. Forewarned is forearmed, as they say. Only by recognising the risk can you take steps to mitigate and prevent it. No one is immune or invincible. As long as we do not take the steps to protect ourselves, we all remain at risk. Caring for others in frontline jobs like yours and mine is demanding. For example, despite my training, experience and considerable skills, if I had to look after my mother after she had a stroke, I believe I would have had the breakdown my sister experienced after stepping up to the plate. My mother was a champion, as is my sister. She loved us and sacrificed her life to give me and all my 7 siblings a wonderful life as we grew up. Both parents blessed us with a fabulous, carefree childhood. For this, we believe we are all deeply indebted. When my mum suffered a stroke, my sister selflessly picked up the baton and cared for Mum until she couldn't do it any longer because she was emotionally depleted and exhausted. Beset by guilt and a sense of failure, my sister became profoundly depressed after our mother passed away. My sister had me for support, but I was far away. My support wasn't enough. She carried a weight that was too heavy for too long. There is more than one reason why I'm dedicated to helping carers like nurses and first responders. These people in our society give the most and expect the least. I take my metaphorical hat off to all carers who understand that self-preservation and looking after their mental health is their first priority. This is the primary motivation behind making this series of videos. Knowing and applying these simple principles can make a profound difference. Sadly, most people don't understand what these principles are, so they don't know how to apply them practically. I hope that we can change this. Cowboys and cowgirls don't cry. Well, actually they do, and they should. The strong, self-sufficient, independent, robust personality is a myth. This personality type does well in the short term, when they're under fire. In the trenches, not only in a war but in everyday life. But they often fall over later when dealing with loss, be it of their health, a relationship, or even the deteriorating health of someone they are close to. It may seem counterintuitive, but in my experience, strong personalities are often more likely to struggle psychologically and become depressed, break down, or even burn out in the longer term. Why? Because they don't talk or express their emotions. They lack the vital skill of knowing how to process emotions, let alone understand why it's so important. While they are good at solving problems on the metaphorical battlefield, they are poor at dealing with and working through the emotional difficulties and interpersonal or relationship conflicts that follow in time. These individuals often isolate themselves if a relationship breaks down, putting them at even greater risk. Social isolation shortens lives while contributing to dementia, and, even more critically, from our point of view, to poor mental health. The take-home message for carers, first responders and the like is no man is an island. Everybody needs support. Having someone you trust with whom you can debrief and unload is as essential to you as it is to the patients I see daily in my practice. It amazes me that simply being there, caring, listening and supporting a patient has been acknowledged as a critical factor in their ability to get through a crisis, psychological issue or emotional problem. You may well recall that in our last video I spoke about the dangers of caring too much, but here I'm referring to the art of caring less. In other words, caring as much as you can afford to, what I call caring to there. I constantly need to guard against crossing that boundary that separates me from my patients and my role as their doctor. You face the same challenge. You cannot have a porous, ambiguous boundary separating you from the person you are caring for. This brings us to the fifth step, dealing with grief. For this, I chose the metaphor of a turbulent, unpredictable, twisting and turning roller coaster. It is a perfect metaphor because it carries over a rich payload of meaning. Like a roller coaster, your grief can twist and turn unpredictably. You experience dramatic ups and downs. It takes time to traverse the terrain and occasionally crash from the precipitous heights to the distressing and depressing lows, before finally settling on stable, solid ground. It is the perfect vehicle to teach the stages of grief, as it has 5 humps symbolising each stage. I hasten to add that one can go back and forth between the stages, as it is not linear. On any given day, the grief-stricken person could be angry, depressed and bargaining, trying to prevent or recoup their loss, by promising to do something or make some significant change. In 1969, Dr. Elizabeth Kubler-Ross wrote in her now famous book entitled On Death and Dying, in which she described the 5 stages of grief: shock, denial, anger, bargaining, depression and acceptance. Whilst this was initially used to describe the typical psychological journey that one takes upon losing a loved one or having to face a life-threatening disease, we now understand that it can follow any significant loss: the breakup of a relationship, the loss of one's health, home or financial security, and even the loss of self-esteem are followed by a grief reaction comprising a similar journey through similar stages. Being a carer is often intertwined with grief, even more so when a caring role comes unexpectedly and is assumed from a sense of obligation rather than taken on by choice. As a carer, it is perfectly natural to grieve for the loss of your old life and the loss of the freedom you had before you committed massive amounts of emotional gold and time to your charges. Then there is also the grief that comes as a result of the gradual but progressive loss of the family member or individual whose circumstances have rendered them dependent. The height of the roller coaster is proportional to the magnitude of investment in the person or the thing that was lost. For example, I once consulted a woman who required inpatient treatment for a major depressive episode after she became suicidal following the unexpected death of her budgie. Clearly she had invested a considerable amount of emotional gold in her bird, which was the equivalent to what others might invest in a partner or good friend. The point is that loss is personal and marries with the emotional gold section. Specifically, loss is proportional to investment. The first hump is shock or denial that the loss has occurred. This is exemplified by the parent who, upon receiving the message of their child's death from the police constable, responds hysterically, "No, you've got the wrong address." So overwhelming and traumatic is the loss that it initially beggars belief. The mind cannot cope, so denial gives us a little time for the terrible truth to sink in and for us to come to terms with it. This is followed by anger, which in the above example may be directed at the individual delivering the message. Anger at everyone or no one, or even at God for not preventing the death of a loved one. Distressed and grieving people often ask, why? Why did this happen? Why them? Why me? We think life should be fair and there must be a reason why bad things happen. Up until this point, bad things always happen to other people. Even though there is an intellectual understanding that we are all at risk, in the midst of acute grief, irrational thinking prevails. If you're on the receiving end of a grief-stricken individual's anger, don't take it personally. They are striking out in pain. It's normal. Keep your guard up and your boundaries firm. Care to there. I need to note that anger is sometimes directed towards the person you are caring for. Sadly, this happens all too often, commonly occurring when carers are overwhelmed and strike out verbally or physically at those they are looking after, who they unfairly blame for deliberately creating more work or being too demanding. In psychotherapy, this process is called countertransference, and it needs to be acknowledged and worked through. This is why psychiatrists and psychologists and carers need access to supervision. Just as every parent can get angry at the baby when they are repeatedly woken up at night and are tired, sleep-deprived and depleted, it is essential to understand that this is a normal reaction and that you need to ask for more help, as well as make allowances and set limits and avoid exceeding them. In the context of processing emotion, the more you can use healthy and appropriate strategies to relieve emotional pressure, the less likely you are to cause collateral damage by striking out in pain and frustration. The middle hump has a curious description. It's called bargaining. This is when one tries to create a solution and prevent a bad outcome from happening by pursuing a particular course of action. It is often associated with some magical thinking. It's akin to trying to negotiate with God. If I go to church more, surely this will be okay. If I do this or change that, I'm sure I'll respond better to chemotherapy and not die from terminal cancer. The next hump is sadness or depression. This is when you or your charges long for and mourn for the loss of how life was before your circumstances brought you to what you perceive as a sorry, depressing past. It is sad and heartbreaking to see someone you love, who used to be well, active, independent and intelligent, deteriorate. It is depressing that your time is shackled to someone who is getting worse. But just remember, the palliative care nurse gains much satisfaction from enabling the dying person to pass peacefully and have a soft landing on the other side. Sometimes that is all you can do and all that can be reasonably expected of you. At the end of this distressing rollercoaster ride of grief, when you have come to terms with what has happened to you, your life and that of your charges, you arrive at the stable level ground of acceptance. This is a journey that takes time. However, it is essential to note that many healthy individuals, when they can see the loss coming, pass through these stages before someone dies. This is called anticipatory grief. Similarly, one partner relationship may grieve for the inevitable loss of the relationship before they leave, only to find their partner in shock and anger when they prematurely move on. Grief is not straightforward or linear. You will often find yourself going back and forth between the different stages. But with support, you will work through the constellation of feelings until you reach the neutral phase of acceptance. As with all the keystone principles, the roller coaster can be superimposed upon the spiral to build more of your framework of understanding, especially with relationship to time and emotional distance. The psychological framework will become a familiar base from which to deal with life's problems in the future. The roller coaster's highest point is in the center, as people in your inner sanctum receive a significant investment of your gold. Hence, the potential loss of this relationship is substantial. I'm sure you can see that the height of the roller coaster mirrors the height of gold bars you've invested in others. The lowest point of the roller coaster is on the outside, to indicate that if you lose someone from the peripheries of your spiral, the loss is slight and the grief is minimal. That's why my patient was seriously depressed having lost her budgie, who was in the middle of the spiral. Yet another patient was unaffected when an estranged parent died. The passage of time is crucial in processing emotion. There is no one size fits all. It is different for everyone. I like to illustrate this with a simple imaginary scenario that I call cat and dad. Imagine your beloved father passes away unexpectedly. It happens at a chaotic and demanding period in your life. Of course you go to the funeral, but you are too busy and distracted to grieve appropriately. A year later, the cat you were fond of dies. You become inconsolably distressed. Your partner comments that you appear to be overreacting. Their apparent lack of understanding and empathy makes you angry. Clearly this is a case of postponed and displaced grief. There is a very good reason why my cat's cry for processing emotion is feel it to heal it. It is essential that we realize that a loss is not just about death. There are many other reasons why we grieve. the loss of the mental faculty of an aging parent, the loss of a dream of having a normal child after having a child with a disability. The roller coaster ride will challenge you in many ways. Knowing what to expect, and especially knowing that things become easier to accept over time, helps us cope. The dual meaning of distance from the middle to the outside of the spiral, and the time taken to get there, is incorporated into the roller coaster ride of grief because it takes time, usually a year, to come to terms with the death of a loved one. Similarly, it takes time to traverse the roller coaster, typically 1 year, to process a significant loss and move someone from the middle of your spiral to the outside. For example, after a serious relationship breakdown or the betrayal of your trust. Many carers experience anticipatory grief when one grieves the loss of someone before they die. And this is often the case when a carer is looking after a relative who is deteriorating physically and mentally in slow motion in front of their eyes. Now let me show you how some of these challenges we've discussed can be illustrated and clarified on your unifying spiral. We'll also see how the roller coaster relates to your other keystone principles by looking at the spiral board and incorporating some of the metaphorical tools we've used previously, such as the emotional ruler and the careless triangle. Finally, we'll work through a few familiar real-life scenarios that will clarify how the processing emotion keystone principle can be applied to help you negotiate and resolve some of the interpersonal problems commonly encountered by carers. Now you'll recall you're introduced to the spiral in some of the other keystone principles. Now just to recap, the spiral, you're placing anyone and everyone on your spiral, safe in the middle, dangerous on the outside. Here is your emotional ruler. Now this is very relevant in terms of processing emotions because I'm emotionally close and these people can hit me with their hurtful comments, or I'm emotionally distant on the outside, remember, behind those boundaries. And of course, this is also very relevant, is caring. We learned in some of the other videos, certainly the gold, we cared a lot about people who are in the middle, but this is the art of caring less. Now, I want you just to consider how other people process emotions, because if they are close, they can affect us. So let's just look at an example of the griever. This is someone who internalizes upset, but you can feel the tension in the air between you. You can't have them close. They need to be moved out. Yes, they may be okay, but then it's unpredictable when they're going to go off, or it's just that tense feeling. This person, the cucumber, cool as a cucumber. This probably is the first responder, the person who's got things in check. And whilst they are likely to be located in the middle, yes, they have their own different sort of difficulties. The boiler. This is a person who bubbles away without actually expressing things, but again, it's a lot more obvious. That's a lot more apparent. As opposed to the griever, who might be a bit passive-aggressive, you certainly know that they're upset. And this person requires a more peripheral placement on your spiral. Well, of course, no surprises where the exploder belongs. You can get hit in the crossfire, so you really need to distance yourself and care less about this person's emotional upset. So they require a more peripheral location on your spiral. This is the first of our scenarios, and it relates to the divider. Now this person This woman has married your son, but unfortunately she's very divisive, poisons him against you, tries to make it impossible for you to have a relationship. And clearly you're going to locate her on the outside of the spiral. But unfortunately, she's shackled to your son. So you're in a dilemma as to where you put them. And I say, well, I divide this up into actually 3 different relationships. Here we have the divider, who belongs on the outside. Your son previously was in the middle. When he's together with her, he's on the outside. But unfortunately, he's actually been poisoned. And by default, sadly, you have to put him on the peripheries. You need to, remember, distance yourself, and you also need to care a little bit less, certainly about her, and unfortunately about him. And of course, this relates to the roller coaster ride of grief, because this is exactly what's happening. You're going through these different phases, and it takes time. Remember, it takes time to actually grieve this loss. The son moving to the periphery is like a death. You're losing him, the future that you would have had, should have had, and you are likely to have problems when it comes to the grandchildren. Scenario number 2 we've entitled The Philanderer. You confront your partner having found out that they're having an affair. They initially deny it, confess, and then want to stay together for the children. Now there's a lot of distress and emotion. You will remember the roller coaster, and initially you'll be in shock. And this person is likely to be put to the outside. But you'd have to come to terms with the loss, the breakdown of the relationship, the loss of trust and everything like that. So therefore I say it does take a year to come to terms with what's happened. And only then would you be able to perhaps renegotiate the relationship and let this person back in. I doubt whether they'll ever get back into the middle. There's always going to be that nagging mistrust. But you can see how you can employ the spiral to help make your way through this particularly difficult life crisis. Scenario number 3 is entitled Mr. McGreedy. In this example, your parents have recently died. Mr. McGreedy is actually a greedy sibling who's gone to your parents' home and taken all the goodies. They claim that they did more for your parents than you did, and therefore justify their actions. The question is, where are they on your spiral, and do you need to reposition them? I find this a very common example where a person's true colours are. At the funeral, we see people act in very unfortunate and disappointing ways. And relationships and families are divided after a funeral, and certainly division of assets or the display of this sort of behaviour. Well, this person obviously is going to be relegated to the outside of the spiral, behind some fairly significant boundaries, because you've lost trust in them, but you're also grieving your old relationship that you had before they displayed this unhealthy behaviour. Scenario number 4 we've entitled The Slacker. Now this is a very common one, and this is something I'd see in the office almost every day. The slacker is a really good friend, but they never make an effort. When you have to organise the catch-ups, you make the effort and they're a passenger. When you go out, you have a great time because they're old good friends. So therefore, you need to reevaluate where they are on your spiral. And clearly, healthy is equal and reciprocal, but this isn't reciprocal. And so in moving them out, I think this processing emotion is about the fact that you grieve the loss of what you could have had, should have had, and maybe did have previously, that good relationship. But you're obligated in terms of self-preservation to actually move this person out and come to terms with the fact that this person's a passenger. Scenario number 5 we've entitled Too Much Too Soon. And this is where your father has got into a new relationship 6 months after your mother had died. And he's pressurizing you to spend more time with his new girlfriend. So this makes you upset and angry. So in this scenario, we once again have 3 separate relationships. Here is your father with his partner, her by herself, him by himself. Now, I dare say that a lot of people would find this intrusion inappropriate and your father insensitive. If you didn't like the new girlfriend, you might put her out. But of course, she's shackled to your father. So therefore, you find yourself in this unenviable position of putting them closer. Whereas your dad might have been here before, you find that these relationships are all shackled together. And it really is your choice as to where you put them, I think, individually and together, because it's likely to be the same. In terms of processing emotion, I think this is just a sad and telling indictment on your father. Having said that, we did give you the example that sometimes people grieve in anticipation of a loss. And it may well be, if your mother had been unwell and dying over the years, your father may have let go a lot earlier than you were. So the arrival in his mind of his new partner may be more appropriate. So there's a number of factors to consider. But once again, the spiral gives us some flexibility and the ability to actually negotiate this and work through with it. There's going to be grief and there's going to be time taken to adjust to this new normal. The 6th and final scenario in this processing emotion section is called the interloper. And this we refer to the biological mother who comes into your life after you've been brought up and happily by your adopted parents. Now, she wants a full-on relationship. She wants you in the middle, but you're actually conflicted. And I say the answer to this is in your spiral. Biologically connected, but you don't know the level of psychological connection. So I say the interloper, your biological mother, must begin on the outside. Now, you may be motivated to want to have a close relationship, but it would be very dangerous of you to fast track her to the middle because you don't know her. So I say she belongs there, you're at emotional distance, you can't trust her. And besides, you've got to be careful, because if you're insensitive about your adopted parents, they may well get very upset and angry. Now, healthy adopted parents would be expecting this to happen at some point in your life. But the point being made here is it's going to take time to get this person back into the middle. And that's only if they are qualified to be there. Just because they're your biological mother, just because you long to have a relationship with them, doesn't mean that it's healthy and doesn't mean that it's automatic. So let the spiral help you negotiate this and just reflect on the principles. Self-preservation. You're going to need boundaries in the beginning. You're going to invest your gold, and in time, hopefully, you can build a healthy relationship. Now, finally, I'd just like to talk about the roller coaster and how it relates to the spiral. Now, remember the roller coaster tossing and turning up and down, twisting and everything like that. A great metaphor for the very turbulent process of processing emotion coming to terms with loss. And here we have the 5 different stages: denial, anger, bargaining, depression, acceptance. You notice we're coming downhill. Remember, the height was proportional to the investment. So here I superimpose this over the middle of the spiral. That's where the height is greatest. That's where the loss of significant relationships occur. And it's a long way to fall. It's a long way to come from the middle to the outside. And here we have the time taken. If the relationship was more out in the peripheries, it's going to take less time. It's a longer time if they're in the middle. So this, our friend here, is going to be moving as you pass through and come to terms with the loss. And you can see why I say that this is the unifying spiral. All our principles, all our tools can be actually superimposed, the keystone principles, as well as our tools on the spiral. That brings us to the end of our Processing Emotion video. Thanks for watching. Because of the complexity of the subject and the additional essential material on the details of how to process grief and loss, this video has been a bit longer than the others. I know there's a lot to digest, but if you break it down to bite-sized chunks, you'll be fine. Remember the old question, how do you eat an elephant? The answer, of course, being one bite at a time. I'll see you again in our 5th and final video, focusing on the organising principle and overarching metaphor that we call the unifying spiral.